connecting people with resources and really being an active part of health and wellness education on campus, as well as connecting people with community resources. I will be sending out an email probably during this Zoom session, an all faculty email that'll also later go out to all staff about mental health first aid, COVID testing, a few updates and reminders about things that are happening health and safety wise on campus. And then this 8 dimensions of wellness, we take this very, very seriously, that in order to be the best learners and the best that we can be, we really need to attend to all dimensions of wellness, not just the physical or emotional, but all pieces of it. And we weave that throughout everything that we do. So if you want to go ahead and advance the slide. And then click back one. So these are some resources that are really very handy for keeping a pulse on what's happening locally with our COVID-19 situation. Matt, if you would click on that first one so we can see the county data dashboard. This is very easily accessible to everyone by typing or Googling santacruzhealth.org. And I think maybe you might need to push control and click at the same time.
So Katie, you can't see my screen?
I can see the slide screen, but I don't see the browser window.
Okay, real quick change, hold on.
Okay.
There you go.
There we go. Excellent. And I'm not sure about for everybody else, but it's rather big on my screen. I wonder if we shrank it down a little bit, if we could see more of the epidemic curve at the same time. But these are great numbers to just kind of be familiar with and kind of get an idea of where we're at. So across the top, it always lists the total number of cases to date, cumulative total, and that matches the orange line on the graph right below it. So far we've had 2,744 cases in Santa Cruz County, and we currently have 200 active known cases, which is higher than it was in, say, May and June, lower than it was, 4 weeks ago. So we're doing all right. And in fact, we're going to look at some slides that show us that we're doing better than we were several weeks ago. But looking at the vertical teal lines gives us a sense of how many cases occurred every day since March. And we do see an uptick in July, coming back down, and then another uptick that was just a little smaller at the end of September. But what's also very important to know is looking at how people get COVID. So looking at the bar graphs next to the epidemic curve, we see that 66.63% of Santa Cruz County residents who've contracted COVID-19 have gotten it from a person-to-person household contact, someone they live with. And then another 8.87% is a close contact that they don't necessarily live with. So we're looking at more than 75% of the cases can be traced directly to someone that you spend a lot of time with for each person that contracts COVID. This I find pretty reassuring in that if we do a good job of keeping our circles pretty tight, and when we're outside of our households contact, and we're out in the community, we're doing those necessary tasks. If we're wearing a mask, if we're maintaining our social distance, we should be able to avoid the infection. And then it's also very important to keep track of who you've been close to, who you've let your guard down around. If you choose to do the 2 or 3 households that are now allowed by the governor's guidance, gathering outside, keeping track of who those people are and continue to be, and what dates you saw who for how long, it will make contact tracing a lot easier. Unfortunately, we have had 25 deaths due to COVID in this county. Lots of them have been more recent because of an outbreak at a skilled nursing facility in the South County. Unfortunate, but this is the pattern that we're seeing around the country, that it gets in a community of elderly folks and gets quite a few of us. So knowing that it's most important to protect our elderly and our folks that have one or more chronic illnesses, very, very important. Many of us can recover, bounce back quickly from a COVID-19 infection, but not all of us. Would you now show us the equity view?
Sure. Just give it a minute to load here.
Absolutely. So what's important to know with our equity view is that this is locally, this is definitely happening more in South County than North County. And a lot of that is about economics. A lot of that is socioeconomics. If we look at known cases by race and ethnicity, we see that while Latinx community represents approximately 33% of our county population, if you hover over that black bar, it'll show that. Our Latinx community is also carrying the burden of nearly 63% of the COVID cases. And that's really about living more closely together, not being able to socially isolate quite as easily, and not having as many options for working from home. And again, the South County population is only about 29% of the county population, yet 63% of the cases are happening there. The other bubble that we see is among young folks, ages 20 to 34. Definitely seeing more than their fair share of cases. And we think that's about COVID fatigue, about shelter in place fatigue, being tired of not doing the things that we enjoy, especially for young folks that are living at home, really wanting to go and mix with others. So that is something that the County Public Health Department is really working on with messaging. Could we now look at indicators? So when this new colored tier system first came out, Santa Cruz County was in the purple or widespread tier. And if we click on it now, we can see that we're in red or substantial. Those numbers should come up. I don't know if you need to click or if it's just loading slowly, but this is updated every Tuesday. Perfect. These numbers are updated at the state level every Tuesday. And this Tuesday, October 20th, was the first time that Santa Cruz County had stayed in the orange level of indicators for an entire week. What that means is if we continue to stay in the orange level, so below 4 cases per 100,000 people in the population, and below a certain positivity rate for numbers of cases. We've really struggled with getting down below 4. And now that we're there, once we stay there for 3 full weeks, we will be allowed to move to the orange tier and open a few more businesses. So that'll be good if we can do that. But that really is on all of us to continue to be vigilant about wearing masks and maintaining that social distance. If we go back to the slides, there's the county indicator link just below that will take us to the little explanation of the tiers.
Just give me a moment, KB.
No worries.
Okay. Does that look right?
That looks right. If you scroll down a little bit,
Right?
we will see a place where you can type in a county name and a sector. And then typically, I was looking for the explanation of the tiers. Interesting that if you click on understand your county status, what happens?
No active link there. So
Interesting. Okay, that changed from yesterday when I looked at it.
Yeah.
Okay, unimportant. You can still get to the county level data through our county webpage, which has not changed at all. That santacruzhealth.org.
There it is.
There it is. Yeah. So there you could type in Santa Cruz and find out, you know, what restaurants are open. Can we eat indoors? That sort of thing. But if you scroll down further, it'll show us the breakdown of the different tiers. Maybe not.
It's going by county.
It's going by county. Okay. All right. That's all right. Definitely, we just need to stay below that 4 per 100,000 per population. There is an equity factor that gets put in if we're leaving our at-risk populations behind. We won't be able to move into that next tier. But we have a good picture of what needs to happen in order for that to go. Let's move to that last slide, and then we'll do questions.
Okay. Well, did you?
No, there's a couple things. Thank you. So there's on the slide that we were still on with the links to the county numbers, the state numbers. There's also some great information about how to connect people with resources. If you're an essential worker, this is a card that is published by the county public health department with lots of resources for lots of different safety net clinics that will absolutely do free COVID testing and evaluation visits in order to help people know, do I need to self-isolate? Do I have COVID? How do I go about self-isolating? All of that information will be available at any of these places, including Cabrillo College Student Health Services. So I want to encourage sharing this information wide and far. And there's also some other good resources around how do I connect with food if I can't go to the grocery store, things along those lines. How do I make sure that my rent gets paid? And then the next one is the COVID-19 guide to self-quarantine and isolation. It's available in both English and Spanish. This is a very excellent document that helps us really figure out who needs to isolate, who needs to quarantine, and really doesn't matter what we call it. How do you go about doing that? How do I, if I live in an apartment with 3 other people, how do I make sure that I'm keeping them safe? Lots of those questions are really well answered here. And I send this to anyone that I'm at all concerned about, and have them follow the guidelines there, as well as provide the isolation orders for anyone who tests positive. And then we also, through HR, we have some good resources available to us there. They have provided some basic information and are very much available to answer further questions about, could I take a leave? For how long? What's covered, what's not covered? Does my situation fit? Absolutely, we wanna share as many resources as possible. The idea being, if you're sick, we don't want you to feel like you have to come to work. We really need everyone to stay safe at home until it is safe to return. We want you to stay away from your neighbors and your friends and not feel like you have to work. So
Great.
Were there any other links on the slide that we
I think
needed
that was
to share?
it, Katie. That was
Okay.
the slide.
Okay.
Yeah.
So I want to go to the visual aid of what's really crucial for preventing COVID. The good thing about having this pandemic last so long is we've really learned a lot about the infection and how it spreads. And we know that if we do stay more than 6 feet away from others, even if they're infected, we're unlikely to get it, especially if we keep our interactions brief. And that means less than 10 minutes, if at all possible. We want to be wearing masks to prevent anything that we have spreading to someone else. And we want things to be well ventilated. Meeting outdoors is always better than indoors. When it has to be indoors, having windows and doors open and fans blowing is very helpful for circulating the air and preventing the spread of infection. So Matt, if you could get that visual aid to share that specific, yeah, you could show that specific image, and then maybe Kristen can help us with questions.
Is it showing?
I've seen them show up in the chat, but I've been busy talking and not reading. Yeah, this is this is just really boiling down to what is important. How do we prevent it? And these are the 4 most important things: keeping interactions brief, masked, distanced, and well ventilated. This is really how we're gonna get through to the other side. So happy to answer questions that any of this brought up.
Okay, Katie, thank you. I'm gonna go back to the chat, starting with Ophelia Garcia. Asked, Katie, would you comment on the person-to-person healthcare setting? Does that include going to a medical facility like Sutter for yearly exams like mammograms or other tests?
Absolutely. We know a lot about screening people and appropriate PPE, personal protective equipment, and what can be delayed and what's necessary. I think the majority of those numbers that we're seeing person-to-person transfer is more than likely our skilled nursing facility, where we had an ill patient and an ill employee, and it spread quickly in that facility. But we've not seen it happening in outpatient care. We've not seen it at the dentist's office. We've really done a pretty good job of providing necessary care in a safe way.
Katie, there's a question from Marcy Wald, first thanking you for the information and asking about whether hospitals can handle the load of people who might be coming down with inpatient COVID care.
Absolutely.
And also, are people still not allowed to visit people who are in the hospital for non-COVID reasons? Yes,
hospital visits as well as skilled nursing visits are still pretty limited. One exception is laboring mothers are allowed to have one support person, and they're updating those sorts of visiting policies so that support person can get relief and swap out with a second support person, but there aren't additional people in the room. Our hospital capacity is great. We have the ability to, between Dominican, Watsonville Community, Sutter, and a field hospital or accessory, I forget what the 3-letter acronym is, but the county is ready for this. The county has additional beds that they're ready to set up in a hotel as a step-down unit to create more hospital beds so that folks that are recovering and no longer need ICU level care have a place to go. So absolutely, while it's important to continue to flatten the curve, we have at most seen 25 people in the hospital at once with COVID, and we have a capacity of hundreds. Not that we want to see that, but we're ready for it.
Great. There's also a point, Katie, you'll share the resources like the the slide with reducing the risks and the link for the card in your emails, that would be great.
Yeah, absolutely.
Okay, and then there's a question from Tasha Sturms asking about travel out of state and the need to isolate for 14 days before coming back to campus. That's still in place, correct?
That is still in place. While it's not a legal requirement, it's not anything that's required by the governor or even our local public health officer. She's still very much encouraging us to continue to have those local policies. It's important to offer that courtesy to each other when you've gone out of your local area and are potentially bringing something back. It is a great courtesy to the people in your life to self-isolate until you're sure any danger of COVID-19 from that travel has passed. What does that mean? That does mean 14 days. Even if we test you at day 5, day 5 or 6 after coming back to Santa Cruz County, you could test negative and still develop the infection on day 10, day 12, day 14, or day 13. By day 14, 0 symptoms, no fever, we're good. You're not gonna get it. If you were gonna get it, you'd get it between day 2 and day 14.
Kristen, you want to ask a couple more before we move on?
Sure. So Leslie DeRose asked that since we now know that the virus is airborne, would a fan inside be dangerous?
No, a fan inside is not dangerous, especially if we're pointing the fan out of an open window or door. And while yes, the CDC has acknowledged that there is some airborne transmission, the highest risk transmission is still person to person within 6 feet, prolonged close contact, which is defined as within 6 feet for 15 minutes. So we know that that's very high risk, and the airborne, if we're following our social distance and wearing masks, the airborne is far less concerning.
Okay, thank you. Christy Pizzera asked if we are taking into consideration the numbers in Monterey County, specifically North Monterey County, where some of our students and instructors live.
Absolutely. I've definitely taken care virtually and drive-through testing of Monterey County students and employees. And absolutely our South County numbers are much more similar to Monterey, San Benito County than it is to North Santa Cruz County. And we need to do something about that. So that's really the push from the public health department to get the message out and offer people resources.
Thank you. And Dr. Kopi Akinjide asked, once a vaccine is developed and offered, will public employees be required to take it?
From my perspective as a public health nurse, it's going to be highly encouraged, and I will advocate for that as a requirement of any on-campus employee with the EOC.
Great. Why don't we do this at this point, Kristen? Why don't we step ahead on the PowerPoint and come back to Q&A, because I think we'll have a lot more. And I want to make sure we get to the other parts of the slide deck. So give me a moment while I reset here and share and advance. Just a moment. So I think we wanted to focus briefly on this slide, and hopefully you can see it. It's Katie, can you see? This is the communication document we're working on now.
Yeah, so this is a new document that we're working with HR closely to develop and really just give everybody a better idea of what to do in what situation. It's designed to be kind of a quick reference, and it's in the early stages, but we're going to roll it out quickly.
Yeah, and the one thing I'll say about this is I want to give appreciation to Jessica, Carol, and CCEU for coming forward to ask for a document like this that will make it clear for employees, if you're working on campus or if you're working from home, who should you notify if you're worried about needing a COVID test or you think you might have symptoms. the main answer is to think about notifying really 3 places or 3 individuals when you have concerns like that. First is human resources. And the reason for doing that is to either have a conversation with Margie or Angela about the leave implications and can you take leave and what kind of leave to take first for being out sick. Then also obviously to talk to Katie in the Student Health Services, and so you can get connected up with resources or even a COVID test if you need it. And then the third one is to talk to your supervisor, just not so much to divulge anything personal about your health, but just to let your supervisor know that you may be taking the leave of absence because of an illness. And so those are the 3 main contacts that you should make: health services, HR, your supervisor. Okay. So why don't we shift ahead? I'm just going to pick up some data that relate particularly to Cabrillo. And I want to thank Katie for keeping her eyes on these numbers and monitoring them as we go week to week. But through October 11th, and this will get updated pretty soon for the following week, Katie's actually done through the health services 79 different COVID tests. It's probably going up to close to 100 at this point. But through that testing process, we've been able to identify 3 staff or faculty from March to this point in time who have tested positive, and then 9 students who have come through and tested positive and let us know that. Only one of those where you would see exposure where it happened in a hybrid class where there were some meetings on campus and also online. And in that case, that's where we took the action to close down the lab space in the building where that happened, make sure that it was shut down for 2 days entirely. And then 2 weeks, we left the class out of that environment so that everybody could quarantine and be safe for 14 days and then come back for instruction after that. And then whenever we have an exposure in a campus facility like that, we're making special arrangements for outside cleaning team to come in and do the deep cleaning that we need to do in response to a COVID case like that. Any comments you want to make, Katie, on this data?
No, only to say that I definitely want to hear about students that are sharing symptoms or positive testing with you as a staff or faculty member. I want to hear about that every time.
Great. So just let me pivot very quickly to how we're operating and planning to operate for the next 3 academic terms. This is a table that basically lays out that we're doing mostly online and remote delivery of services and instruction. We do have the difficult to convert classes that will meet face-to-face on campus. And there's a safety plan associated with each one of those courses so that we know the protocols that are going to be observed. And if you've been involved with instruction on campus or seen it, there are temperature and symptom checks that happen every day. There is social distance spacing in those class environments and a real attention to symptoms. And if the student's not feeling well, they're not supposed to come on campus. Same for staff and faculty. And then for the spring semester, summer of next year, and even going into the fall semester, we are planning to operate using that same approach to instruction. So, pardon me, most of what we will be doing is online and remote delivery, and where we can have difficult to convert classes be offered face-to-face, they have to have a plan in place to remain healthy and safe for our staff and students. And keep in mind that we're following industry guidelines that are being put out by the California Department of Public Health, monitoring the governor's ratings of the tiers of safety. And particularly, we have guidance on institutions of higher education that we're following in using in the EOC whenever we look at plans for instruction or special events. I want to talk briefly about the CZU fire and the impacts that we've had here. I think I might have shown this at our last all college Zoom, but we had a real impact that first week of classes, and the evacuations that were caused by the fires had an effect on 28% of our students and staff population. We had a large contingent of evacuees that were here in the parking lot next to the gym. And if you look at our enrollment trends, what happened in a fall to fall comparison is you can see in that first week that we lost about 306 full-time equivalent students who were dropping courses because of the evacuations related to the fires. And the concern moving forward is that for many students who are impacted in the north part of our county, in San Lorenzo Valley, up in Felton, Boulder Creek, around Bonnie Doon, that they will be facing not only the impact of the fire, but also the long-term threat of mudslides due to rain in the winter months. So there could be a longer term effect on enrollment at the college because people are going to have to be dealing with not just one natural disaster, but two in the span of 4 or 5 months. So it will have an impact on Cabrillo for sure. Then finally, before we open it up for question and answer, I just want to focus on the pivot that we're making with our website and our new logo. This has all been funded by a grant from the Monterey Peninsula Foundation, about $200,000 in funds that were used to establish a new website for the college. And really it's designed to enhance prior funding that they had given to the college for guided pathways work as well. This new logo treatment and color design palette is coming from work that was done by a local design firm, designed by Cosmic. And it's also been helped by participation of our marketing and communication staff and students associated with guided pathways. And in fact, the students helped to select the final design that you've seen and the color palette that was chosen as we go forward. And you can see some of the collateral material possibilities that we have with things like sweatshirts, t-shirts, swag, notebooks, things like that. And if you've been paying attention, the website was designed to be launched back in the summer. We put it on hold because of the COVID emergency and just the amount of work that everybody was doing in shifting to online instruction and online delivery of services. And we've now postponed it even more because we did not want to have a rollout in the middle of the semester with some of the technical bugs that were showing up in designing the various pages. So our new revised launch date for the website is set for the end of this fall semester. And we'll actually be asking people to finish their pages around December 2nd, so that we can have about a 2-week period of quality checking of links and how the jump from link to link is working. So I don't want you to lose sight. If you've been working on some of the website redesign, keep doing that, keep plugging ahead. The more that we can get done, the better we're going to feel about the quality assurance testing when we get out to December and flip the switch to a new server and a new website starting in late December. So with that, I'm going to open it up for Q&A with a picture of me with my fabulous St. Louis Blues mask. And I'm going to stop sharing so that I can see the chat window as well. I do want to thank Katie for all of her great work and putting the presentation together. She's been dynamite in our EOC and just a wonderful resource for us to rely on. So why don't we go back to question and answer, and Kristen, why don't you pick it up from the chat box wherever we left off. And I think we had stopped with one from Kofi, if I remember correctly.
Yes, thank you. So Mark is the next one, who asks, if the numbers stay the same or decrease, would Santa Cruz County progress to orange phase on 11/3?
If that is exactly 2 weeks from the 20th, then yes. Yes, indeed.
Okay, thank you.
I had a question come in, I think, privately to me, asking about if I'm going to have a dinner with some folks outside on this weekend, are there some tips that you would give in terms of having that kind of like a restaurant seating outdoors? Does that sound okay?
Yeah, I think as much space as possible between people, 6 feet and then staggered. That's going to require either separate chairs away from the table or giant tables, but it can be done. We can sit at a table together more than 6 feet apart outside and feel safe.
I think Sarah Castillo had a question about if we have decreased or plateaued numbers, what does that mean for our campus? And I think what I would say is we're going to continue to operate in this mode really until vaccines become widespread in their delivery. That is the safest way to operate as a college where you've got a large commuter population that are coming from homes and then coming to the campus and then going back home. So in reality, the safest way to envision reopening Cabrillo fully is to think of that widespread distribution of vaccination, essentially getting control over the spread of the pandemic. So that's why the decision is made so early to think about spring, summer, and even into next fall. If fall does present in fall of 21, that we have a widespread delivery of that vaccine to all of our employees and students, then we can probably make the shift to that face-to-face return to sort of normal. But we're not going to do that until that happens. That's basically the operational mode we're coming from in the Emergency Operations Center. Okay.
I got a question privately as to whether or not we know how many of our students and staff tested outside campus.
I only know the ones that are reported to me, and included in some of those positive figures are at least 2 people that tested outside of Cabrillo.
Great, thank you. There was a question about recommendations that 6 feet is a minimum and more is usually better. Katie, what are your thoughts about that?
Agreed. 6 feet is good, more is better, shorter is better, outside is better. Yes.
So one thing, there's a question later down in the list, and I'll come back to the D2C classes, but in Cheryl Kern Jones asks about, in planning for our eventual return, does air circulation and turnover rates of air, is that being assessed for facilities? And the short answer is yes. And in fact, one of the things we did in August into early September was an airflow analysis of rooms that were going to be planned to use for difficult to convert courses. So we had scheduled spaces for labs and for studio work, music labs, things like that. And we wanted to make sure that the airflow analysis looked good in each of those settings before we actually gave the go-ahead and said yes. And so one of the things that's happened is in that airflow analysis, we've learned that in VAPA, for example, in the VAPA complex, Visual and Performing Arts, one of our buildings was not performing up to standards. And so one of the work projects we have scheduled during this period is to actually go in and improve the mechanical systems in the Samper Theater 5000 building, I think it is. So those courses that were meeting in that building actually got shifted out of that building because the airflow analysis did not come back saying that we could definitely feel safe about it. So we ended up pivoting some of those courses and moving the music lab, and IT was fantastic. The arts, John Gralty, the entire staff in the arts and VAPA have just been wonderful in how they pivoted to shift those out of those rooms into other different rooms that could meet the airflow standards. So that was a long answer. The short answer is when we come back, we want to make sure the airflow is working well. So actually another project that we're thinking of doing is in the building 100. There are airflow HVAC systems that we want to improve that ring the outside of that building so that the counselor offices, career transfer centers, spaces like that have better airflow when we come back and are operating face-to-face as well. Then there was a question earlier, a couple up. Let me just go to that. Just a moment.
Sarah Castillo question?
Yes, yeah. Could you read that one?
Asking if the D2C classes will be revisited for adjustment.
Sarah, they will. The short answer on that is faculty and deans should be looking for an email very soon from Paul Harvell and or Mark Ramsey to restart the difficult to convert class review process. And so we'll want to make sure that a similar kind of form and format will be done with this second iteration. For many of them, it will be a repeat of the information that we have on hand, but there may be, some new courses and new course sections that need to get reviewed. And we may want to rely on some of the information from faculty and staff about how to tweak or alter the plans, but that should be coming out very soon.
Okay. I went down to a question from Marcy Wald about when will instructors teaching in the spring and using links on the college website have access to the new ways to get to Cabrillo pages? And that's a really good question. We had to take into consideration not wanting to disrupt the faculty's submissions of grades. So as soon as the grading submission deadline is over, then we will flip the switch on the website, which will give people the end of December through January to check your links in Canvas and make sure the web URLs are up to date. I was notified that we missed a question from Kofi about whether or not COVID is spread on surfaces.
We responded to that in the chat because I saw that too, that we skipped down to the second question. But the moral of the story is that it's much more dangerous to have prolonged close contact with somebody that's actively infected than a surface that they've been near recently. And we are going to follow CDC guidelines continuously and shut down any room that we know has had exposure for a minimum of 48 hours.
Thank you, Katie. There's another one in there from Elena saying, once we get to the yellow zone, will we commence in the classrooms?
Oh my gosh. When I hear yellow zone, I think of the airport, no parking in the yellow zone. I honestly haven't looked at the threshold for yellow at all. So I have to confess, I don't know the answer to that, Elena. I don't know, Katie, if you do.
And I'm feeling like it's all precarious, that we're guaranteed to stay in any tier for a minimum of 2 weeks so we don't have to flex so much back and forth. But what a nightmare to flex back and forth during the middle of a semester. So I support our current plan of staying with just difficult to convert courses until we have a vaccine. And we know that we're going to stay with low numbers and have a real way to protect people.
Yeah. And one thing I forgot to mention earlier when we were talking about notifying people if you have concerns about COVID or somebody in the house or a student, you feel you might have exposure. I mentioned 3 people to contact: HR, Katie, and a supervisor. You want to do that by email probably first, or by a phone call, because you don't want to just show up, for example, at Katie's office or HR, for example. First of all, somebody may not be there because we're all working remotely. So making the electronic contact first is a really good plan, by email to schedule an appointment or do a quick email that says, hey, urgent, I need to talk to somebody. And then we can have the face-to-face meeting with Katie or with HR or somebody. But mostly it's going to be by Zoom in a screen like this, unless you're getting a positive or trying to get a test whether or not you're positive or negative.
Right. Jessica Carroll asked about some on-campus student support services offered prior to the transition back to campus in spring of 2022. Will there be some? And if so, who determines which ones? And if employees are uncomfortable working on campus, then what?
Yeah, I don't want to push people to work in an uncomfortable manner and feel like they're not in a safe environment. This has been one of my concerns that, and this is an equity concern across the board, across really the whole higher ed landscape. By having fully remote delivery, there is a disproportionate impact on poor students and students who are Latinx and African American. And so the worry is that when we don't have some in-person services available for them, disproportionately that impacts their ability to succeed as a student and to complete or have access to services. On the other hand, I want everyone to remain safe and healthy. And so it's weighing that tension between access and success and disproportionate impact and the safety considerations that are in play. So if people believe that they can structure some kind of face-to-face or hybrid delivery of a service, they would need to develop a kind of a difficult to convert service plan that would show how are you going to operate that service delivery in a safe manner that has the physical distancing, that's going to have the symptom checking, that's going to make our students and our staff safe. And then that's still going to get vetted by our emergency operations command team. And safety is the number one priority. I've said that in a couple of emails as we've gone through this. So if that cannot be constructed in a safe way or staff are not feeling comfortable about it, we don't want to launch into a service delivery in that modality. And I want to say this about particularly our essential staff who are on campus and are working. One thing to remember, if you're not one of those employees, is to be very cognizant of the work that they're doing. So as an example, signing the sheets that are on doors to let people know when you're going into a building. When I came in today, there's a sign on the door into SAC West for me to sign. And that alerts the custodians and the facility staff to know that on this particular day, from 11 a.m. until tonight, I was in this room. So it gives an indication of where cleaning can be done and not have to worry about any kind of exposure. And you need to be cognizant of staff who are essential and who are working and continue to work on campus in that manner, grounds, facilities, some of our business services office staff, occasional HR, on occasion me coming into the office. The reason we're doing those sheets is it's low tech, but it's a very easy way to track who's been in a particular building or a particular office so that we know if we have to do cleaning or tracing back to who's been in that building, we know that there's a register of it. So bottom line, I don't want staff worrying about health conditions and safety conditions. And if they do have that concern, they should be having a conversation with their supervisor, or again, maybe drawing in HR, or even alerting me to it if you're not feeling safe. Okay.
Matt, while you're on that topic, a question came in the chat that's related about employees who are essential on campus, and then the fact that the public tend to use Cabrillo as a park with dogs and maybe not social distancing, and kind of wondering what we can do about that.
Yeah, the best way to approach that is the way that Robin Mitchell from the sheriff's office tends to do it, is to very politely tell them that they do need to observe safety protocols while they're on the campus. So if they're walking a dog, for example, it'd be nice if they're wearing a mask and to ask them to do so. Robin will frequently go into parking lots and see people using our campus as a recreation spot. I saw somebody rollerblading the other day when I was here on Sunday. And if you see that and they come up towards you or to ask a question, the best thing is to be just polite, remind them of the various protocols that we have. We don't want to shut the campus entirely down. There are people who do want to come and exercise and run the stairs or run the paths, or they want to use the bike path or hiking path up above at the top of the campus. that's going to happen. We are a public space that does get used in that manner. What you want to do, though, is if you are an essential worker and you see people who are clearly abusing the protocols, working out in groups that are way too proximate to each other or close together, either go approach them and politely ask them to obey our guidelines, or better yet, contact a supervisor. Let us get in touch with them. I'm often on call. John Salisbury's on call. Robin and the Sheriff's Department is on call to help in those situations. So don't feel bad about reaching out to a supervisor and going up the chain of command and letting us handle it. We'll be glad to step in and confront it. The other thing to say about this is that Owen Miller has been great, and I think Owen is in on the meeting today as our safety officer, in doing spot inspections of classes that are running or events that are scheduled. And occasionally I will make a visit to look in on a class or an event. So that photo that you saw at the start of this all college Zoom was a photo that I took after I observed what was going on with the chorus class and Cheryl Anderson's great job at spacing all of the students around the Cessnon lawn. I've made visits to other classes as well, and I know Owen has been much more religious at going and checking out lab spaces to see how the safety protocols are going. And he will tell you, and I will tell you, that he has the authority to shut a class down or shut an event down if they are not abiding by protocols. Same for me. And where we are allowing special events to come in, they are being approved at the EOC and by me as an incident commander, and I'm not approving anything that Owen or Katie are not going to be happy with. So the safety protocols that we see, we expect in writing, we expect to go see when we go out and visit an event or a space. So that also takes place with our farmers market on Saturday. I know that Owen makes regular visits there, and I'm usually there incognito on a Saturday morning to buy some veggies, and I will check to see that people are abiding by the protocols there too.
Right, thank you. There was a question up in the chat about whether rapid result COVID testing is available in Santa Cruz County.
Yes, through the county public health department, both North and South County, they do have the Binax Now through Abbott, where they're able to turn out results within 2 hours. And you can, at that same website, santacruzhealth.org, and then pushing on the red button that says COVID-19, and then scrolling down to the bottom of the page, there's a button for Get Tested. All of those resources for COVID-19, including Cabrillo Student Health Services, are listed there.
Great, thanks, Katie. A private question in the chat of, will the library be open for students during online instruction?
I don't think so. I think that the library has gone fully online, and there may be a librarian or a rep in the room, I'm hoping, but.
I saw Michelle Morton.
Yeah, I did too. Now, Aloha says online only, yeah.
Okay, there you go.
Okay. One thing I want to do before we close, I know we're coming up on the hour. I do want to give a shout out to Poco Marshall. I know he had a comment and a question in the chat box, but Poco has been working with the EOC, and particularly with me and John Gralty, on live stream concerts, solo artists who've been performing on the stage of our theater. And Poco and Elk have been doing a great job at organizing those events in a very safe manner, and have gotten really good kudos on the performances that they've been able to bring to the campus and curate for our public. And I know the artists are really appreciating it, and the families of them as well, families and friends. So thank you for that work. Okay, with that, let me bring it to a close. Katie, thank you so much for everything, all the work you're doing, and the information is spectacular. Really appreciate it. Thank you everyone for coming, and we will try to plan another all college Zoom in November as well. We'll try to come up with some other topics, and thanks for being here, everyone. Really appreciate it. Keep it up.